Hi, it's Ray Gustafson, joined on the line by Dr. Mark Nikkel, board-certified orthopedic surgeon with Bronson Orthopedic and Joint Specialists on 950 South Bailey Avenue in South Haven. Give me a little background, Dr. Nikkel. Why are you so good at what you do?
Well, I did my residency in Chicago. I did a fellowship in sports medicine for a year in California, which really focused on sports and athletic injuries. And practiced in Chicago for about 15 years, and now I've been in South Haven for the past 4 years. I enjoy sports, and I think that's who I am and why I enjoy taking care of athletes and patients that have athletic injuries.
So we want to talk about running injuries and how to avoid those. I've been a runner since, probably middle school. I got cheap, doctor. I was always buying the good shoes. And then it came time to replace them. Didn't have the $200 or $300 to get a good pair of shoes, so I bought a cheaper pair of shoes. And within a couple of months, I was feeling some of the effects. What are some common injuries that do affect runners besides shoes? And I know those are important, right?
Oh, definitely. Shoes are extremely important. I think one of the, there's many injuries that can occur with running, but the most common I see is runner's knee. This is typically due to weakness in the lower musculature, running mechanics, again, type of shoes that are being used, the weight of the person, and the type of running surface.
So I've been doing some research, obviously, since I've not been able to do it, and I walk a lot, but about what's it called, plantar fasciitis, did I say it correctly? Is that pretty common with runners, and how can that be treated?
Well, yes, plantar fasciitis. It's a disorder of connective tissue which supports the arch of the foot. Typically results in the pain of the heel and the bottom of the foot that's usually most severe, typically with the first steps of the day or following a period of rest. The causes typically are long periods of standing, an increase in exercise, and obesity. Most cases typically will resolve in time with conservative methods involving rest, change in activities, anti-inflammatory medication, and stretching. More severe cases are prescribed physical therapy, given injections, and orthotics. When I see patients that have failed all those things with conservative measures, I recommend an outpatient surgical procedure that's performed under local anesthesia.
So what kind of treatments are available for people if they do end up getting, having some joint pain while they're running or as the result of running?
Well, the first thing I, again, discuss with someone that has plantar fasciitis is if it's caused by activity, they got to stop that activity, typically avoiding impacting activity. Better shoe wear, I know you've already brought that up, but shoe wear is so important to prevent this. Cross-train. Some of these patients that, if you know runners, it's a very addictive type of activity.
It is.
And it's hard to tell a runner to stop running. So I plead with them, please cross-train and involve other physical activity. 3 activities that I recommend for patients that have severe plantar fasciitis are biking, elliptical, and swimming. These are great options that take the weight bearing away and will still give you a good cardiovascular workout. In addition, I incorporate medications, physical therapy, injections, bracing, and of course, surgical treatments would be the last option.
So if anybody listening has a running injury or think they might, how can they set up an appointment with you to get checked out?
They can call our office, Bronson Orthopedic and Joint Specialists, and call 269-639-2866.
269-639-2866, or stop by 950 South Bailey Avenue in South Haven. Dr. Mark Nikkel, board-certified orthopedic surgeon with Bronson Orthopedic and Joint Specialist, 950 South Bailey Avenue in South Haven. Thanks for the tip there, good doctor.
Thank you, Ray. You have a wonderful day.